What is Advair Diskus used for? Advair Diskus, Advair HFA, AirDuo Respiclick is used to treat difficulty breathing, wheezing, shortness of breath, coughing, and chest tightness caused by asthma. Advair Diskus is also used to prevent and treat wheezing, shortness of breath, coughing, and chest tightness caused by chronic obstructive pulmonary disease, COPD, a group of lung diseases that includes chronic bronchitis and emphysema. Advair Diskus is used in adults and children 4 years of age and older. Advair HFA, AirDuo Respiclick are used in children 12 years of age and older. How should this medicine be used? Advair Diskus comes as a powder and as an inhalation solution to inhale by mouth using a specially designed inhaler. It is usually used twice a day, in the morning and evening, about 12 hours apart. Use Advair Diskus at around the same times every day. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Use Advair Diskus exactly as directed. Do not use more or less of it or use it more often than prescribed by your doctor. Talk to your doctor about how you should take your other oral or inhaled medications for asthma during your treatment with salmeterol and fluticasone inhalation. If you were using a short-acting beta-agonist inhaler such as albuterol, Proventil, Ventolin, on a regular basis, your doctor will probably tell you to stop using it regularly but to continue to use it to treat sudden attacks of asthma symptoms. Follow these directions carefully. Do not change the way you use any of your medications or stop taking any of your medications without talking to your doctor. Do not use fluticasone and salmeterol during an attack of asthma or COPD. Your doctor will prescribe a short-acting inhaler to use during attacks. Advair Diskus inhalation controls the symptoms of certain lung diseases but does not cure these conditions. It may take a week or longer before you feel the full benefit of Advair Diskus. Continue to use Advair Diskus even if you feel well. Do not stop using Advair Diskus without talking to your doctor. If you stop using Advair Diskus inhalation, your symptoms may return. Before you use Advair Diskus, Advair HFA, or AirDuo Respiclick for the first time, read the written package instructions that come with it. Look at the diagrams and package instructions carefully and be sure that you recognize all the parts of the inhaler. Ask your doctor, pharmacist, or respiratory therapist to show you how to use the inhaler. Practice using your inhaler while they watch, so you are sure you are doing it the right way. If your child will be using fluticasone and salmeterol inhalation, be sure that he or she knows how to use it. Watch your child each time they use the inhaler to be sure that they are using it correctly. Never exhale into the inhaler, take the inhaler apart, or wash the mouthpiece or any part of the inhaler. Keep the inhaler dry. Do not use the inhaler with a spacer. What special precautions should I follow? Before using Advair Diskus oral inhalation, tell your doctor and pharmacist if you are allergic to fluticasone, Flonase, Flovent, salmeterol, Ceravent, any other medications, milk protein, any foods, or any of the ingredients in Advair Diskus oral inhalation. Tell your doctor if you use another LABA such as formoterol, Perforamist, Indulera, Symbicort, or salmeterol, Ceravent, in Advair. These medications should not be used with Advair Diskus inhalation. Your doctor will tell you which medication you should use and which medication you should stop using. Tell your doctor and pharmacist what other prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking. Be sure to mention any of the following: certain antifungals such as itraconazole, Onmel, Sporanox, and ketoconazole, beta blockers such as atenolol, Tenormin, labetalol, Trandate, metoprolol, Lopressor, Toprol XL, Nadolol, Corgard, and propranolol, Inderol, clarithromycin, Biaxin, Inprefpac, diuretics, water pills, HIV protease inhibitors such as atazanavir, Rayataz, Indinavir, Crixivan, Nelfinavir, Viracept, Ritonavir, Norvir, and Sequinavir, Invirase, Other medications for asthma or COPD, medications for seizures, metronidazole, Flagyl, nifazodone, and telithromycin, Ketic, no longer available in U.S. Also tell your doctor and pharmacist if you are taking the following medications or have stopped taking them during the past 2 weeks: antidepressants such as amitriptyline, amoxapine, clomipramine, anafranil, diazepamine, norpramine, doxepin, Silanor, imipramine, tofranil, nortriptyline, Pamelor, protriptyline, Vivactol, and trimipramine, Sermentil, and monoamine oxidase, MAO, inhibitors, including isocarboxazid, Marplan, linezolid, Zyvox, methylene blue, phenelzine, Nardil, selegiline, Eldepril, Emsam, Zelapar, and tranylcypromine, Parnate. Many other medications may also interact with fluticasone and salmeterol, so be sure to tell your doctor about all the medications you are taking, even those that do not appear on this list. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if you or anyone in your family has or has ever had osteoporosis, a condition in which the bones become weak and fragile, and if you have or have ever had high blood pressure, irregular heartbeat, seizures, hyperthyroidism, overactive thyroid, diabetes, tuberculosis, TB, cataracts, clouding of the lens of the eye, glaucoma, and eye disease, any condition that affects your immune system, or liver or heart disease. Also tell your doctor if you have a herpes eye infection or any other type of infection and if you smoke or use tobacco products. Tell your doctor if you are pregnant, plan to become pregnant, or are breastfeeding. If you become pregnant while using Advair Diskus, call your doctor. If you are having surgery, including dental surgery, tell your doctor or dentist that you are using Advair Diskus. Tell your doctor if you have never had chickenpox or measles and have not been vaccinated against these infections. Stay away from people who are sick, especially people who have chickenpox or measles. If you are exposed to these infections or if you develop symptoms of these infections, call your doctor immediately. You may need to get a vaccine, shot, to protect you from these infections. What special dietary instructions should I follow? Talk to your doctor about eating grapefruit or drinking grapefruit juice while taking this medication. What should I do if I forget a dose? Skip the missed dose and continue your regular dosing schedule. Do not inhale a double dose to make up for a missed one. What side effects can Advair Diskus cause? Advair Diskus may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Runny nose, sneezing, sore throat, throat irritation, sinus pain, headache, nausea, vomiting, diarrhea, stomach pain, muscle and bone pain, dizziness, weakness, tiredness, sweating, tooth pain, shaking of a part of your body that you cannot control, sleep problems. Some side effects can be serious. If you experience any of the following side effects, call your doctor immediately. Coughing, wheezing, or chest tightness that begins soon after you inhale Advair Diskus. Hives, rash, swelling of the face, throat, tongue, lips, hands, feet, ankles, or lower legs. Choking or difficulty swallowing. Hoarseness. Noisy, high-pitched breathing. Pounding fast, or irregular heartbeat. Fainting. Chest pain. Cough. Burning or tingling in the hands or feet. White patches in the mouth. Fever, chills, and other signs of infection. Advair Diskus may cause children to grow more slowly. Your child's doctor will monitor your child's growth carefully. Talk to your child's doctor about the risks of giving this medication to your child.